I think it's a common misconception because haematology is a specialty that actually incorporates both clinical and laboratory, and most of us are trained in both specialties, so we actually take the patient from the bedside to the bench.
We are actually fully trained as physicians, and our laboratory training is additional to our physician training.
My work is probably half and half, laboratory and clinical, and the clinical is in the whole department probably 80% of the total work, I would think.
The big difference between haematology and some other aspects of clinical medicine is that, unlike other specialties who rely on somebody else to perform the investigations, with us we see our patients, we then go to the laboratory, look at their blood, look at their marrow. More importantly, we understand what those results show, and then we can take that back to the clinic.
Most haematologists spend most of their time looking after patients, and we have direct input into lots of people's lives and the family. So indeed, it is a very broad-based specialty rather than a pure laboratory-based specialty.
I'd say that the spectrum of disease in haematology is really huge, ranging from the management of leukemias and other haematological malignancies through to bleeding disorders, clotting disorders, a number of genetic diseases like thalassemia, hemochromatosis, and of course the management of patients who are having massive transfusion requirements.
You're often very useful to the general medical teams by sorting out what their haematological problems in their patients with other diseases is as well.
Yeah. So anybody that has done a round with us on the ward knows that we are generalists in a true sense of the word.
I'm surprised to see that because, I mean, general medical patients to me always seem very much older on the average, and all of their diseases are degenerative diseases that you really can't do much about the outcome. You just follow them along until they get worse and worse. Whereas hematological diseases are very treatable often, and people are cured of their hematological disease.
Well, I currently only see children, adolescents and a few young adults.
Most of the times we probably do see people in the 20s ranging to about the 50s, so certainly not elderly. And most of the times we can do things to these patients because they're younger, so elderly is probably not right as well.
You know, compared to other specialties, I'd say it's quite a young spread of patients.
At Women's and Children's Hospital, the Haematology Oncology unit is second only to general paediatrics in terms of activity, and we've certainly got funding through a number of quite prominent community charities.
The profile is increasing at the moment. Certainly haematology is an established specialty in South Australia. We know that we have got a IMVS facility set up in terms of if we want to do research, we have got the ability to do that. We have got the tissue bank to do things to sort of take the haematology profile higher. We are able to attract people to work in South Australia.
If they're interested in the basic funding to the haematologists, then I think that that's a very good, you know, that there's quite highly remunerated, even especially if you're in the pathological side of it.
I mean, certainly the profile is up there, and I think South Australia certainly is on the map, but needs to be raised further.
So there's a lot of opportunities to get funding to do what we want to do. Adelaide, in the last 30 years or so, actually has made quite a name internationally. People realize what a progressive unit we have been. Even though we're a small population, we have concentrated on identifying areas in which we could use our science and our clinic together. We're not a big clinical trial center as such, but we are more a boutique research center where we recognize our skill and focus them in areas that we can make a significant contribution.
Adelaide has a history of high achievers in the field. while some others might mention our reputation with chronic myeloid leukemia and also in pioneering the collection of peripheral blood stem cells, we've also had a number of people who've used Adelaide as a springboard to very successful careers. Relative to other cities within Australia, Adelaide's got a lot to be proud of.
So I think that in selected things we're leaders, and in most things we have a outcome analysis that's the same as the people who describe the treatment. For example, in ALL treatment, the Germans are the sort of leaders in outcome for ALL in adults, and our outcomes are on the same par as them. We've taken the numbers out and compared them, and so I'd say we're well up there.